Hello, ACU and ICU staff. I've never done this before. I hope that we look back on this video, recording, training, in-service event that you're doing at your staff meeting and think about how innovative and memorable this was, as opposed to creepy and awkward like the Blair Witch Project video. So what I'm gonna talk about today is care plan shift summary, and it's one of your quality goals for 2015. So there's three main references that I'm going to use for this presentation. The first is the plan of care policy that's located on Policy Stat, and you all have access to that, and I expect that after this you'll be so inspired you're going to go look it up to learn even more about care planning than we cover in today's presentation. The next is a 45-page document that also I hope you download and read. That's from the Oregon State Board of Nursing. It has some really specific expectations that are for nurses that really are the basis for the Joint Commission and CMS requirements for care planning. And then the last one is the audits that I do for multiple components of care planning, but today I'm just going to focus on the results that we're finding related to your quality goal on shift summary. All right, here's our super low-tech report of how outcome shift summary behavior is going in your department. Notice the bar to the far left is our goal bar. It's highlighted in yellow, and that's set at 95%. We expect when we audit charts that 95% of the time we will find that the nurse has completed a goal outcome shift summary in the chart. And you will notice that there have been 2 months that this has been achieved. Now, mind you, your quality goal was really just set in January, but I've been auditing and you can see your trend, which is also posted up in your break room. So congratulations, in February, 100% of the charts that myself and Dee audited were found to have an appropriate outcome shift summary when they were required. Okay, so what gets audited? Why are we auditing? What happens with this information? Common questions that people ask me when I'm up in the unit doing the audit. So I am mandated to do audits on care plan as our site coordinator way back when we started on Epic in 2013. And I actually have trend data that goes back all the way to our go live date about care planning. We only audit inpatient charts, even though in Hood River we care plan on our patients all the same way. If they're a swing bed, or really if they're an EHOP patient, we do care planning on everybody. But for my system audit, I only report the patients that meet inpatient criteria for at least 24 hours at the time that I conduct the audit. It's totally random who gets audited. Really, I go up to the unit between 1 and 4 days a month, and I do every patient that meets criteria, and I have to do at least 10 a month. That's basically what our volume demands to be a valid audit volume. And some months I do a little bit more, but generally I shoot for the 10, and in addition to the minimum requirements of my system audit, I do a lot more deeper dives into making sure that the correct CPGs are applied. So most of you on day shift have probably received coaching from me about selection of CPGs, about missed shift summaries, individualization, all those sorts of things that I notice during the time of my audits. And night shift, I've tried to send emails both to really praise some of the great care planning that I observe in the care plan audits, and also to offer some coaching about where some deficits are and opportunities for improved reliability. And then what do we do with the data? So really, in the beginning, we just wanted to get our arms around, both at a system level and a local level, of like, what's our baseline? We didn't do audits on care plans before we went up on Epic. So I can't speak to what our efficacy on care plan requirements were before then. So we needed to get a pretty decent baseline. And what our baseline really shows us is a lack of reliability in key components of care planning. And now we're at a place, both at a system level and a local level, where we know we really need to focus in on this. Some important parts to remember, and actually I was having this conversation with Alan a couple weeks ago, is that care planning is required both by the Oregon State Board of Nursing in your scope of practice definition, and by CMS and by Joint Commission. And so it's not optional. It's not one more thing. It is, the regulatory agencies will in fact be asking all of you to articulate the impact of your care planning in the care of a patient. So we want to make sure that your care plans reflect the great care you provide, and that you can speak to that when anybody asks, whether it's me or your patients or the Joint Commission. A quick recap: when do we do an outcome shift summary? We do it every time we hand over the patient. So we do it at our traditional handover times when there's shift change, and anytime we hand over the patient, for example, if the patient goes to surgery, or you're handing over because you're going to go home low census mid-shift, the offgoing nurse is required to do the shift summary. All right. Also, if there's a significant change in status, it's another time that we would expect to see a shift summary done. For example, your patient falls, your patient who's in med-surg gets admitted, now escalated into the ICU setting, or there's a big behavior change. Would be another example of a reason you do that. And then the last reason is any reason the patient leaves the hospital, whether that be that the patient has died, and or if we're discharging them to home, or if we're transitioning them back to an assisted care facility. So any reason the patient leaves the hospital, I just air quote that and say anytime we discharge the patient, and then anytime we hand over. And then that one that sometimes we do forget, but we didn't find any of those in February, were when there's a major status change with the patient. Okay, so what is this shift summary about? What are we trying to do in this shift summary? It should be a really brief statement. It should be about a paragraph long, and it should hit 4 major considerations. The first is to evaluate the effectiveness of the current plan of care. You take basically what your plan has been with that patient, and you really are evaluating whether it's effective. Is the patient progressing towards our goal? We need to make sure, number 2, that we are identifying specific barriers to us achieving that goal, and then modify our interventions accordingly within the body of the care plan. The third is that it should be used as an interdisciplinary care team communication enhancement. So we can be making sure that we're including considerations about the physical therapy care that's being received, or wound care ostomy consultations and nutrition consultations that have happened with this patient. The shift summary looks at the patient globally, and so we really want to make sure that we're including the other disciplines in our shift summary. And the last piece is to make sure that we understand the patient's response to our treatment. So both objectively, how are they progressing medically towards the goals, and also holistically, how are they responding, or what's the patient's perspective to the care plan, and making sure that we make modifications that are considerate of that. So in summary, It is a summary that takes the 12 hours of care you did, the interventions you provided, and compares it to the plan that was in place. And you need to then summarize how that all went. I tell people who are struggling with this, especially new nurses, I usually lay it out like this. If you ran into the physician in the hallway between patient rooms and they said, "How's Miss So-and-so doing in room 201?" what would you say? And just exactly what you would say to that physician probably makes an awesome shift summary note. Sometimes it's helpful to be clear by defining what something is not. The shift summary is not where we document our assessment or our interventions. We do that in the doc flow sheets. We do that all day long in the doc flow sheets. What's unique about what we put in the shift summary is the evaluation of the day, the evaluation of our interventions. And that is the essence of what is unique and why it is so important that nurses do this every single shift. We take all the pieces, all those components about individual CPGs, and we wrap that up in what nurses do that's unique, which is to analyze whether that's effective, to critically think about whether that's helping or not helping. And then we make plans. We put in place strategies to overcome barriers. And that's what we need to see in the care plan summary. Okay, so the language that we use in the shift summary that we're evaluating is whether the patient is progressing, not progressing, declining, or adequate for discharge. Those are the 4 evaluative languages that we use. And that's just a drop-down box. The summary that you write should support why you made the decision of those 4 categories. All right, so here's a couple of examples of shift summaries that really are on the right track. So status is progressing. Majority of shifts spent coordinating with hospice and trying new strategies for decreasing pain. Spiritual care offered but declined at this time. Designation of family member, sister who's an RN, to be the family spokesperson. Anticipate DC home tomorrow at AM. Now that pain is controlled for the first time since admit with fentanyl patch. Here's another one. This is a person with a pneumonia and a dementia CPG, as well as a fall CPG. So, progressing towards goal. Interventions for fall prevention effective. Team ensured that patient has cares rounding every 30 minutes. Prepare for night shift sitter. Breathing less labored and able to ambulate with PT and hall today. Improved oral hydration and caloric intake. All right, so I know it's time to wrap it up because it's been about 10 minutes, and also because the blue tape I had my iPhone taped to my monitor with broke free. So now I have to handhold the iPhone. So I hope you guys think about your shift summaries in a new way, and I look forward to hearing your feedback about this presentation. And I want to thank you for your commitment to excellence and growth in your clinical practice and telling one great patient story at a time, one shift summary at a time.